Hello everyone. Today we'll be discussing about calcium in pregnancy. Calcium is the most abundant mineral in our body. It keeps our bone healthy and strong. It regulates blood vessel tone, supports nerve muscles function, and it plays a key role in blood clotting. See, in this part of the lecture, we'll be talking in detail about calcium, how it functions, what are the absorption ways, and what different kind of calciums are available. So during pregnancy the body demand for calcium rises to support both the mother and the developing baby. If the diet does not provide enough calcium, complication can occur. Now, about 25 to 30 gram of calcium are transferred to the baby during the pregnancy, and nearly 80% of this transfer happens in the third trimester. Now, here is the interesting point. The daily calcium requirement for the non-pregnant, pregnant woman, and lactating woman is essentially the same, about 1000 to 1200 milligram of essential calcium per day. So, how does the mother body meet this extra demand during the pregnancy? The answer lies in the natural adaptation. The intestine increases calcium absorption driven by hormones like calcitriol and placental lactogen. At the same time, kidney also enhances the calcium absorption, helping conserve calcium for both mother and the baby. Now we'll talk about in what places calcium is useful during pregnancy. Now, see, first and most important part about calcium is its prevention of hypertensive disorder. In what ways does it help? Now, it helps by decreasing the risk of preeclampsia and gestational hypertension. See, in endothelial cell, calcium normally enters through channels, activates nitric oxide synthase, and produces nitric oxide. Now, this oxide causes blood vessel relaxation and prevents inflammation. When calcium intake is low, less calcium enters the cell. This reduces the nitric oxide production, which leads to vasoconstriction, oxidative stress, and inflammation. In vascular smooth muscle cells, calcium usually maintain normal contraction and relaxation. So with the deficiency, the cell becomes more sensitive to hormones such as angiotensin 2 and norepinephrine. This causes stronger contraction, more resistance, and high blood pressure. Now, see, in the placenta, anti-angiogenic factors such as soluble FMS like tyrosine kinase 1 and endoglyn are released. Adequate calcium protects against this harmful effect. When calcium is low, the endothelial response becomes exaggerated, leading to inflammation and injury. The overall result is cascade of vasoconstriction, hypertension, and inflammation. Adequate calcium breaks this chain and lowers the risk of preeclampsia. Clinical studies confirms this benefit. A Cochrane review shows that at least 1 gram of calcium daily reduces the risk of preeclampsia. Even the World Health Organization recommends 1.5 grams of elemental calcium daily in 3 divided doses, that is 5 milligram each, starting from 20 weeks of pregnancy to prevent from preeclampsia. Now, bone health and maternal protection during pregnancy, 25 to 30 gram of calcium are transferred to the baby. This is especially important in the third trimester. If the mother intake is low, her own bones are depleted. Adequate calcium protects against this bone loss, osteopenia, and osteoporosis in the long run. Women with low calcium intake are more prone to fractures later in life. With supplementation, bone recovery after childbirth is faster and long term bone health is preserved. Now, fetal skeletal and deltoid development. By the end of pregnancy, the fetus requires, as we know, 30 grams of calcium. This is critical for bone formation, bud development, and future bone strength. Deficiency can cause growth restriction, poor mineralization. Studies using ultrasound and bone density scan has shown stronger bones in newborns when mother receives calcium. long term shows that children whose mother has got the calcium during the pregnancy have a better bone density. Now next point is about reduction in preterm. As we have seen that calcium reduces the chances of preeclampsia. When the chances of preeclampsia is reduced, then it will eventually lead to decrease in the premature birth. Another thing is calcium helps reduce uterine irritability and prevents premature contraction. So a Cochrane review in 2019 also found that supplementation lowered the risk of preterm birth by about 24 percentage, especially in women with low calcium intake. Now, prevention of maternal complications. Calcium improves iron use when not taken together with tablet. It prevents rare conditions such as hypocalcemic tetany, and it also reduces the risk of fractures after delivery. What are the effects of calcium on metabolic and endocrine? See, calcium regulates insulin secretion and sensitivity. It may help lower the risk of gestational diabetes. It also supports thyroid and parathyroid balance during pregnancy. Other thing is the it helps in neurodevelopment of the fetus. It is essential for brain development, nerve signaling, and neurotransmitter release. It prevents maternal leg cramps and muscle irritability. It reduces the risk of seizures in newborn that is caused by low calcium. It also supports lactation by building calcium reserves in the mother. Finally, calcium ensures normal uterine contraction, reduces the risk of dysfunctional labor, and protects the cardiovascular system of the mother. Now, we have discussed what are the uses. Now, from where and how to get the calcium. See, normally most of us are of vegetarian diet. So, we'll look into some of the calcium rich food which are present in the diet. Then we'll see what supplementation and what kind of supplementation will help us. Now, dairy products are the most reliable source of calcium. One glass of milk gives around 120 mg of calcium. I'm talking about elemental calcium now. Yogurt about 138 and paneer nearly 350 grams milligrams per 100 gram. So these are all the very excellent source for calcium. Even calcium said tofu is also excellent, like tofu in which there is a higher amount of calcium. Now, among plant foods, sesame seeds, that is tal, almond, and ragi are very rich in calcium, but the absorption is only moderate because of the natural plant compound which are like phytates. Moringa or drumstick leaves are especially valuable. Dried leaves are extremely rich, and fresh leaves are also a good source. Spinach looks high in the calcium, but most of it cannot be absorbed because oxalates blocks calcium. Fenugreek and other leafy green still make a useful contribution. Now, in the non-vegetarian food diet, the best source is small fish that are eaten with the bones, like sardines or mathi, which gives around 240 mg of calcium, elemental calcium per 100 gram. And this calcium is very well absorbed. Shrimps and eggs gives modest amount, while chicken and other meats are poor source of calcium. In summary, for pregnant women, the most dependable calcium comes from dairy, calcium fortified tofu, fish, which are eaten with bones, and plant-based foods added variety but are less efficient source. Balanced mix can help you absorb the calcium in a daily requirement. Supplements that are available. See, there are many supplements available, but we'll talk about the four main types. One is calcium carbonate, calcium citrate malate, and coral calcium. Now, first, calcium carbonate. This is the most commonly and widely prescribed form in India. Each 1250 mg tablet provides about 500 mg of elemental calcium. It is cheap, concentrated, and works well when taken after food. But the catch is it needs stomach acid for absorption. So, women with acidity medicine or low acid state may not absorb it fully. It can also cause gas, bloating, or constipation. Now we'll talk about calcium citrate. See here, calcium citrate, the tablets which are available in the form of 1000 mg tablet form. But out of that 1000, uh, elemental calcium is only 210 mg. It absorbs independently of stomach acid. So even if the woman is on antacid or gastric issues, this will benefit. It causes fewer stomach problems, but the tablets are bulky, more costly, and you need more dosage because you are getting only 210, almost half the dose of calcium carbonate. Okay, now the next part is calcium citrate malate, that is CCM. These are like found in the brands like, some of the brands like XT containing Supracal XT, Caldicin XT. In this tab, there is added calcium from, it's like, calcium citrate is 1000 mg, which gives 210 elemental, plus there is calcium titrate that also gives added calcium. That makes it the tablet, this Supracal XT or Caldicin XT gives you around 250 to 300 mg of calcium, elemental calcium, and it also has vitamin D3, magnesium, and zinc, which helps in better absorption. It has an excellent solubility, is better tolerated, and in pregnancy, absorption naturally rises to 45 to 60%, making it very efficient. But compliance is better. Usually just one tablet twice a day. See, the dose we have to double, because in calcium carbonate we are giving 500 mg of elemental calcium in a single tablet. Here in one tablet we are just able to provide something around 250 to 300 mg of elemental calcium. So we need to double down the dose when you are giving. Okay, the only drawback is the cost compared to the carbonate. Now, another form is coral calcium. What is coral calcium? See, it is nothing. It is just same as calcium carbonate, but it is derived from the natural coral source. It gives same amount of elemental calcium, that is 500 mg, that is present in calcium carbonate. And absorption is, it is not different from the synthetic one. It is marketed as natural and often much more expensive, but offers no realistic scientific advantage over standard calcium carbonate tablets. Now, uh, so see, if a patient comes to us during our antenatal visit, so how to do the dosing of the calcium? See, first we have to ask about how much elemental calcium she is able to get from her diet. That diet chart I have given, you can check, you can compare approximately how much of the elemental calcium she is able to get from her diet. If a vegetarian diet is there, something around 400 to 600 mg of elemental iron she will be able to get. So to for the daily requirement dose of 1000 mg, you have to add another 500 mg of elemental calcium, that you can add by giving one calcium carbonate tablet of 1250 mg. Now, if a patient has a predisposition of preeclampsia, has a gestational hypertension, is overweight, having uterine artery notch during her NT scan, if those are the factors where you think that patient might have preeclampsia in the future, you need to increase the elemental calcium dose to at least 1200 to 1500 mg of elemental calcium. So you give calcium carbonate twice a day. This will at least achieve her 1000 mg of elemental calcium from the tablet and additional from the diet. This will help her in prevention of preeclampsia. See, when you give an adequate amount of calcium during pregnancy, a patient who has a risk of preeclampsia, this calcium fulfillment will decrease 50% of preeclampsia chance. So it is very important and has a good advantage if you give it in a proper dosing. So proper dosing is must. Even if you can also give up to 3 times a day, there is no problem in it. If a patient is a very low diet of calcium, that is like 100 mg, 200 mg, max to max 300 mg, then start around 3 times a day. This will help her. The key points: in the second trimester, absorption efficiency of calcium rises about 40 to 50%, and in the third trimester it reaches up to 50 to 60%, because the body is preparing for bone mineralization. So whichever salt you choose, absorption improves later in pregnancy. Now we will talk about some pharmacological aspects about it. See, calcium carbonate is best taken with meals, because the acid in the food increases its solubility. Calcium citrate can be taken with or without food. Calcium absorption in the intestine is limited when given in a single large amount of dose. Dividing the total daily dose in smaller doses, for example 3 times a day, improves the absorption and reduces the digestive side effect. The maximum amount that you can give is 500 mg in a single dose. Like in a morning dose if you are giving, or in afternoon if you are giving, give 500 mg max. Then like in evening give another 500 mg, but during one time only give 500 mg. Now adequate vitamin D is important for calcium absorption. Many prenatal regimes combines calcium with vitamin D, usually cholecalciferol in doses ranging from 400 to 1000 international unit. Now, proton pump inhibitor or low stomach acid in patient taking acid suppression therapy such as PPI, omeprazole, calcium citrate is preferred over calcium carbonate. Now, what are the special counseling points that you can explain to a pregnant woman? Now, always tell the patient that we are prescribing about the elemental calcium. This means the active part of the tablet. Please check the labels of the amount of elemental calcium available. Smaller divided dose of 500 mg are absorbed better than a single large dose. Take calcium carbonate with meal. If you are taking medicine for acidity, such as proton pump inhibitor, inform your doctor. We may switch it to calcium citrate. Keep a gap of 2 to 3 hours before calcium tablet and iron tablet. Means always take calcium tablet and iron tablet separately. Drink enough fluid and include fibers in your diet to reduce constipation. If you experience severe stomach upset, let us know so we can change the formulation. And the most important part is avoid unregulated supplements, because they may contain harmful substances such as heavy metals. Now we'll talk about interaction of calcium with other medicine. First about the iron. See, calcium supplement reduces the absorption of non-heme iron. Therefore, calcium and iron should not be taken at the same time. The recommended practice is to take iron in the morning and calcium later in the day, keeping a gap of at least 2 to 3 hours. This improves iron absorption and helps prevent anemia during pregnancy. Second one is thyroxine and calcium. See, in a pregnant woman with hypothyroidism, levothyroxine is essential for the mother's health and for the baby's brain development. Calcium interferes with the absorption of levothyroxine. Therefore, levothyroxine must be taken first thing in the morning on an empty stomach. Calcium should be delayed by at least 4 hours. This ensures that the thyroid medicine works effectively. Vitamin D and calcium. See, vitamin D helps calcium absorption and supports the bone mineralization. Unlike iron or thyroxine, vitamin D works together with the calcium. They can be prescribed at the same time, often as a fixed dose combination, to support maternal bone health and fetal skeletal development. Now we'll talk something about safety of calcium during pregnancy and some side effects. See, calcium supplementation in pregnancy is considered safe when taken in the recommended dose, that is 1 to 2 grams per day. See, maximum go up to 2 grams per day, that's fine. I'm talking about elemental calcium. The most common side effect are, we know, constipation, bloating. These are usually managed by dietary fibers, include fluid intake, or give stool softener if it is needed. See, the risk of kidney stone in pregnancy is generally very low. But women with past history of kidney stone may require a close monitoring. See, concern about cardiovascular risk have been reported in the older non-pregnant adult, but this have not been established in pregnancy. However, long-term counseling you can do about this. Hypercalcemia is very rare at a standard dose, but may occur if there is underlying parathyroid disease, certain granulomatous conditions, or excessive intake of vitamin D. If symptoms such as nausea, vomiting, increased urination, or confusion occurs, blood calcium level should be checked. Yeah, one more thing. Vitamin D, I just want to talk about that. See, always try to give vitamin D in a daily format way. Never in a bulk, like the sachet form, or injection forms, like 60,000 sachet, 60,000 international sachet, or 6 lakhs international unit injection. Why? Instead of helping, it is slightly not good. If you give it in a daily manner, this will help in absorption of calcium in a better way. It will decrease the bone resorption also from the maternal. So uh, the guideline says always try to give calcium and vitamin D especially in a daily manner, like 1000 international unit for a daily uh, is more than for daily supplementation is more than enough. If a patient is deficient in vitamin D3, then you give up to 2000, but above that is not recommended. And giving a bulk doses is also like weekly sachet is not good during pregnancy. Otherwise, normally a non-pregnant woman you can give, that is all right. But during pregnancy, try to give it in daily way. Anyway, we are giving calcium and it has some form of vitamin D, so give a dose which has 1000 or 2000 if you understand the patient is having vitamin D deficiency. Okay, yeah. Next thing, something about breast milk. See, the breast milk contains about 200 to 300 milligram of calcium every day. So when you are breastfeeding, 200 to 300 mg of elemental calcium is going to the baby, and these are always drawn from mother's bone. This causes a temporary bone loss around 3 to 7% in the first 6 months of breastfeeding. Usually, this bone loss recovers well after weaning, but if the patient is taking adequate amount of calcium. Now, why is calcium important in this phase? It helps protect maternal bones, prevent osteoporosis, and keep the teeth strong. It also prevent cramps, tingling, and hypocalcemic symptoms. Emerging evidence shows that it may even reduce the risk of postpartum depression and fatigue, while also supporting better breast milk composition and faster recovery. Certain women needs extra calcium. Those with repeated or closed space pregnancies, teenage mother, woman on vegan or vegetarian diet, those with lactose intolerance, and women who had severe blood loss during delivery. So that's it. We are done for the day. Thank you.